Hi, my name is Amy and I'm a respiratory care student with the respiratory care department. And so before I begin anything with a patient, I need to check the charts and see what the doctor has ordered. And if there's anything that I need to do while I'm in there, check anything. So here I have a patient that's been intubated already. So the first thing I need to check with the tube that's in place, I need to make sure the balloon is properly inflated. That way there's no leaks or anything when I attach the Ambu bag to the patient. And so as long as we are going along with this, we need to make sure we keep a check of the stats of everything, of like the patient's SpO2, make sure they're getting plenty enough oxygen to them, see if they have any chest rise at all. If there is a chest rise, like a spontaneous one, we need to make sure, like when we do the Ambu bag, it needs to be along with the spontaneous breathing. So before I begin, I need to check my Ambu bag, make sure I have the proper Ambu bag that I need. I have the proper tubing. So this here, I'm going to connect it to my oxygen source here. And then I would turn it to 15 liters per minute. And also, before I assist the patient, I need to also make sure my hands are clean and I have the proper gloving, masks if I need any, and even a gown if I feel like there might be something that might splash out. So when I attach this, I'll attach this to here, to the endotracheal tube here. And so then I would watch the chest rise as I squeeze. So you need to do 12 to 20 breaths every minute. Now I need to make sure when I do this, I need to give it enough time to deflate and inflate, so I'm not over inflating the patient's lungs. And if you notice the bag goes down, I need to make sure this bag stays inflated also before I actually proceed on. And once I'm done, I would remove this bag, then I would turn off this, and remove it, and place it in a proper protective area. And then I'd reassess the patient. So then I'd hook up anything if they need to continue to have the ventilator. I'd reconnect the tubing to here. And then I would check the patient's vital signs, and then I'd chart anything that I noticed, like with their chest rises, if they weren't quite getting enough air to them, and then if I need to make any proper adjustments to the tubing, if it's been placed too far down and it's not in the proper placing. So when I notice the chest rise with the mannequin here, it goes to the right side where the tubing is. So it's only inflating the right side, and so then I need to make sure I need to remove this and place it in the appropriate thing, so that way both lungs get the appropriate amount of air to them. So once I'm done, I'm all done charting. I need to make sure I wash my hands, remove any PPE that I may have on, like gloves, gown, mask, anything like that. And then I am all finished then.